And welcome back to News Talk. Dr. Timothy Pfister is live in studio to answer your dental questions. Before we get to any calls, though, we were talking about the bite.
Right.
Now, you brought some visual aids here, so
Right.
I'm going to hold this up first because this is a special tech scan you're talking about, right?
Yes.
I'll put this up over here so
Yes.
the director can get a shot of it.
Yes, the tech scan is very valuable, Jason. And normally dentists today, and myself included, we do, if you're doing one tooth, we'll utilize articulating paper or bite registration material that will allow us to just analyze that one bite. But if we notice breakdown of the bite, like ground down teeth, fractures, cracks in the teeth, maybe bruxing at night, or pain and headaches and whatnot, we can utilize this tool called the tech scan. Now what that allows us to do is we can have a little, if you notice this, it's a little bite wafer, cellophane thickness that helps transfer the articulation of the patient into the computer. And what we can see on our first screenshot, if you'll
put this
hold
back
that.
up? Okay, we can do that.
Yes, you can see that on the screen there, we have basically this bottom graph, and we can see that the green line represents the left side of the bite, the red line the right side, and we can see, if you notice, it's force versus time. And as we progress, we can go to any point in time and analyze the bite and see where the imbalances are. So you can see in this particular screenshot, the patient is not able to come into full force until about 2.5 seconds. And you can see there's a lot of differences in the red and green arrow lines initially. So after we analyze that and we do the balancing of the bite and corrective actions, then we can see in our second screenshot
I'll bring
here.
this one over here.
Yes.
I'll take it and put it in here so we can just go
see
like
it a little
that.
better. Now you can see that right away the red and green lines are able to come into full bite balanced at less than half of a second. And then the full force, which is the gray line, is able to come into full force less than, well, 1.2 seconds, which is most ideal. So by utilizing this technology, we're able to get rid of destructive forces within the bite and thereby allow the patient to have a more even, as far as balance of the bite in terms of overall headaches and whatnot that may be affecting them also.
Fascinating information that we've come so far.
Oh, right.
Before it was just basically, don't you just put something in and just check, and then you look at it on a piece of paper and see if it's grinding the right way?
Exactly, and now computers have allowed us to take this to a whole new level, where now we can really analyze the full bite and all the destructive forces utilizing the technology that allows us to make that more balanced, know where to make the corrective action, and now able to stop the destructive forces that may be within the bite that we couldn't really necessarily see as well before.
How much of a difference does something like this make for someone that maybe, and we've only got about 30 seconds, so I'll keep it quick, like if they have a partial or something like that, can you do the same thing?
Exactly. No matter what it is, if it's a partial, a full denture, a bridge, implants, all of this technology helps us to balance all of that restorative work in a more holistic manner so that the patient can be more comfortable and overall health better.
Good stuff, Doc.
All
Always
right,
good to see you.
Jason.
Thanks for coming in.
Yes.
We'll wrap up the newscast after the break. Stay with us.